Welcome to Mission in Motion, a minute with Maxwell, where we connect people, purpose, and possibility through meaningful conversations with leaders who are shaping the future. Today, I'm joined by the President and CEO of the Canadian College of Health Leaders, an organization at the forefront of advancing leadership across Canada's healthcare system.
And so if you think of like what leaders look like today is that we need to be chameleons. We need to have understanding of what's happening 5 years from now and understand who we need to set in place to make that happen.
In this first part of our conversation, we explore the evolving landscape of healthcare leadership, what's changing, what's needed, and how organizations and leaders can better prepare for the complexity ahead.
We're constantly being bombarded with information. And what that's done is that's shrunk time for leadership development, but also not shrinking the appetite for leadership development.
We'll also dive into the national perspective on health human resources, leadership development, and the capabilities required to lead effectively in today's environment. This is a conversation grounded in experience, insight, and a deep understanding of the realities facing our system today. So let's get started. I'm Heather Maxwell, and I would love for you to join A Minute with Maxwell, Mission in Motion. So welcome, Sue Owen. Perhaps you can just take a minute to introduce yourself.
Thanks very much for having me, Heather. So Sue Owen, I'm the President and CEO of the Canadian College of Health Leaders, and I've been a member of the college now for 28 years and was involved at the chapter level and at the board level. And so it's amazing to have this role at this stage in my career.
Wow, that's amazing, Sue. You have such a wealth of expertise, and I'm so excited to talk to you about all of this today. So to start us off, I always like to ask people, what was your first job and what did it teach you that has stayed with you throughout your leadership journey?
That's a great question. So, if I think of my very, very, very first paid job was a telephone solicitor. And so, like back in the 80s, it's hard to imagine for younger folks today, but back in the 80s, there was, use the phone. And so I was a telephone solicitor for Suitor Portrait Studio. So I was selling $20 packages of portraits. So I would say in that role, that was like doggedness. There was a 4-hour shift and you had to make a certain quota. And so the art of communication, and actually accepting rejection, because there was certainly out of like 100 phone calls a day, I may have sold 2 or 3 packages. And so that's something that has really stuck with me because in life, there is a lot of rejection. And so to be able to manage that and keep going, I think is really important.
It sounds like it really taught you persistence and perseverance, right? In a role like that. Wow. And customer service really at the end of the day, right?
Yes, that's right. Yeah, that's right.
Absolutely. And so can you share a bit about your path into healthcare leadership and what continues to drive your commitment to this sector today, Sue?
Yeah, it's a great question. So I grew up in a house. My mother was a nurse. She loved nursing. I strongly considered medicine. I was, enjoyed the sciences and enjoyed that. So I actually started undergrad in kinesiology at University of Waterloo, thinking I would go into medicine. And through summer jobs and other roles, I did the co-op program at University of Waterloo. I actually really enjoyed the office environment, the administrative environment. So I did one of my work terms at the Department of, Industrial Relations, which is strange for like a kinesiology student, but I got the chance to work in downtown Toronto, which I love the hum of the city. I got to work in an office and work as part of teams. And so I did change my perspective in terms of what I wanted to do. So I went from there to, I did apply to a number of different programs in health administration. And it's funny how things work out. I had applied to do an MBA at McMaster because they have a program where it's a health stream MBA, and I was number 2 on the wait list. And that would have been convenient because originally I was from Hamilton, and I didn't get in. And at that time, you had to write the GMAT exam. So I thought, I'm going to do everything I can to get in next time. So I took the GMAT prep course the viewer was going to write the GMAT again. And in the prep course, I met a woman in that course who said, you should think about University of Toronto and do your Master's of Health Administration at U of T. And so that stuck with me. I ended up doing the GMAT again. I applied to U of T. I got into U of T. And what's really interesting is that the U of T program is very small. So there's like 18 to 20 people. So people in the class before you, the class behind you, and obviously in your class. I never saw that person. So I thought, it was interesting that I got this push from the universe to take a program. And so anyways, I ended up doing University of Toronto Masters of Health Administration and really enjoyed that program. We had to do work terms there. I loved working at Women's College. I did a 6-month placement at Women's College and was kind of hooked. Yeah.
Wow, that's amazing. My brother actually worked at Women's College. So that's so interesting. Wow, it's a small world at the end of the day, right? But that's so interesting that someone gave you that push. And sometimes that's what we need, right? Is we need to talk to people about what it is, what our interests are, I should say. And then you never know where that inspiration might come from. So that's so interesting. Wow, great. And then from your vantage point at the Canadian College of Health Leaders, Sue, how would you describe the current state of healthcare leadership across Canada right now?
Yeah, I mean, it's a great question, and there's so much to unpack with that. One of the things that reminds me of going back to when I did the Masters of Health Admin program. So back in the mid 90s, some of the leaders were telling us, when you are our age, you're going to look at this as being like the era of plenty. And I remember thinking, it doesn't really feel like that. But in fact, that's the case. And so we are operating in a landscape that is, there's a harsh reality of fiscal restraint. There is, the drive to provide services for an aging and increasingly chronic population. We have an aging workforce. We have different needs in the workforce. We're dealing with the 5 generations of the workforce. And so when we think about leadership today, we have all of those things. So we've got individuals who are nearing the end of their careers. Their ways of working are very different than someone that would have graduated in, 2010. And so what that creates is sometimes conflict in ways of working. And if you think of things like leadership it's a lot about strategy. It's about implementation and monitoring and measuring performance. It's also about innovation. And if you think about the rapid adoption of innovation, and we talk about AI, and it's not as simple as hey, we're going to put in AI mechanisms. Organizations have interoperable systems, and so if you think of like what leaders look like today, is that we need to be chameleons. We need to have understanding of what's happening 5 years from now and understand who we need to set in place to make that happen. And so it is not just a dynamic environment, it is both a complicated and complex environment that requires a level of interoperability that we've never seen before.
That is so true, isn't it? And especially, I think you're right with the 5 generations in the workforce is huge right now, number one, but also the integration of AI. And I think everyone is looking at their organization saying, how best do we adapt? Where do we need AI? Where can it be helpful? And it's really, I think it is putting pressure on leaders to know exactly how to do that and do that successfully at this point, right?
And do it strategically, because there's a reactivity. Like, it's not as straightforward as saying, oh, like just use Copilot or use Claude or use
Yeah.
one of these things.
Yeah.
There needs to be a foundation of how do we use AI tools or agentic AI tools? How do we understand what the implications are? How do we
Yeah.
understand the risks? How do we use it interoperably?
Yeah.
And what are the best places to use AI? So again, I remember a couple of years ago, I was in consulting and I was doing some work for the OMA, and we were talking about AI tools to do note taking for family physicians. And so, great idea. How do you implement that while managing the risks and privacy? And again, all of those things are interoperable. So, we have this ecosystem that is very dynamic, ever changing, and as I said, interoperable. And
Yeah.
so, for leaders to keep pace with that, it's not a linear trajectory to leadership.
No.
It's
No.
a 360-degree
Yeah.
evolution that's going on.
Yes, that is so true. And the risks are huge in healthcare, as we know. So that has to be forefront and in front of, top of mind, I guess, when we're implementing things like AI, right? Is what risk is involved as well. So
That's
yes,
right.
that is so true. And so, when it comes to the strategy and the national leadership direction, Sue, what are the top strategic priorities for the Canadian College of Health Leaders right now? And how are they shaping the national leadership agenda?
Yeah, it's a great question. So last year I spent the better part of 6 months traveling from coast to coast to coast to actually ask that question. What do our
Mm,
members want and need? How does that look different in 2026 than that way have looked even in 2016? And
yeah,
there's a couple of things. I think it's not leadership is leadership is leadership. I think there's always this appetite for leadership. I think how we consume or access leadership development has changed materially. So back when I was a recent graduate, we went to a course. We sat in a course for 2 or 3 days and we got a certificate and then we moved on. And back in those days, I wasn't sitting in front of my screen. I would leave my office at 5 o'clock or 6 o'clock and I would turn off.
yeah,
Even in, I was saying to someone back in 2007, even though we had Blackberries at the time, we would stop work at 5 or 6 o'clock and you wouldn't really look at your emails again into the next morning.
yeah,
And so if you think about where we are right now, we have a very dynamic, busy, there's data smog. Like we're constantly being bombarded with information.
yeah,
And what that's done is that's shrunk time for leadership development, but also not shrinking the appetite for leadership development.
yeah,
And so the nexus of that is what leaders are telling us what they want and need is micro credentialing, micro learning, micro programming. Some leaders want that asynchronously. Like I heard from leaders like, look, I'm a director and I've got 2 teenagers. So when I leave my office, I'm a taxi cab and
yeah,
I've got things to do. And so people like that need asynchronous. Our
yeah,
senior leaders are saying, you know what? I want to be in leadership development with my peers. I'm
yeah,
okay to take 2 days and be in person.
yeah.
We're also learning that intermediate level leaders want more of a community of practice. And so
Mm,
those individuals are wanting a mix of hybrid and in person. And
mm,
so for us, what we're thinking is how do we take our leads framework and create learning environments that meet those needs? How do we create micro credentialing? How do we create micro learning? How do we create so that people can access it in terms of their needs?
yeah,
And the other thing that occurs to us too is that people also want a learning passport.
yeah,
So there's so much cognitive load in our day-to-day lives. Our members are telling us that, you know what, if I am just right out of MBA and I want to be a VP in a hospital somewhere, I'd like to know what the next 10 or 15 years looks like. And I want to go to the college. I don't want to be,
mhm,
it's not a buffet from other organizations. I want to be able to go to that one place and have confidence that that one place will offer that to me. Because one of the things that I heard over and over and over again is that our leaders want to have a sense of community. is
Hmm.
that there's a certain inertia what's going on right now and how busy things are and dealing with our patient and family populations and resident populations is that
Hmm.
people want a sense of community because
Hmm.
reality is healthcare is a team sport and
Yeah.
we need other teammates around us to help to bolster the weight of all of that work that we're doing.
Yes, that is wow. That is a lot of good information, Sue. And it sounds like you and the college have done a lot of research on what members are looking for right now and how they are able to consume educational materials, right?
Yes.
Around their business schedules, their home lives, all of those pieces. So
Yes.
that's so important. Wow, that's such good information. And so you mentioned leads, Sue, and how is the CCHL actively supporting leadership development across such a complex and diverse healthcare system?
Yeah, and there's no one way to do it. I guess that would be my way of
Yeah.
perspective. Right now, the college offers roughly seven different offerings in terms of leadership development. We are anchored in the Leads leadership framework, which is five domains: L, lead self; E, engage others; etc. And a lot of our members have taken a lot of those courses related to leads. So we have
Mhm.
five different courses that relate to leads. Leads learning foundations being one of them. We do Inspire Nursing Leadership Program in partnership with the Canadian Nurses Association. And then we have our Certified Health Executive and our Fellowship Program. And that creates a great foundation for us. But what our members have
Mhm.
told us, Heather, is that it's limiting. It's kind of one and done. So I do my CHE and I'm done, and I get excited about being in the process of learning, and I'm done. And so, interestingly, and it's almost a perfect timing. The Leads framework is undergoing a refresh right now. And so the
Oh,
college is partnering with Royal Roads University, Leads Global, and CHL Net under a MyTax grant to say, the five domains are going to be probably unchanged, but the capabilities that those sit on top of will need to change.
oh, wow.
And it's been an 18-month journey, and there's a lot of amazing information. So what the college will be doing is taking that, and the first step would be create a crosswalk to say, okay, if this is what leaders from coast to coast to coast want,
Yeah.
what are we currently doing,
Mhm.
and where are the gaps? And eventually what's going to happen is that we'll create a matrix of offerings of micro credentials and micro learnings, which could be stacked.
Yeah.
So if you can imagine LEADS, we've got the five domains. If you can imagine six or seven courses across each of the domains, that you'd
Mm.
say I can pick and mix, whatever interests me, and we price them in a way that is cost sensitive, or
Yeah.
we stack them so that there's 7 units in L, lead self.
Yeah.
Maybe that's your certificate in personal leadership.
Yeah.
We also know that what our leaders want is a deeper dive in equity,
Mm.
and sort of diversity, excuse me, and inclusivity. And so that will be embedded into all of our course offerings. And if you want to do all of potentially 30 or 36, that would be your learning passport. Or if you
Yeah.
want to do a certificate in equity, if you want to do a certificate in creating coalitions. Like there's a whole host of options. And
Yeah.
I think what's really important is that we know we can't be developing those things on our own. So I'm a
Mm.
PhD student. We do have someone who is PhD trained in our office. And we have so many volunteers, PhD trained educators, masters certified trainers. We have so many people ready, willing, and able, is that we'll also be evolving that to what I'm going to call a faculty model. And so
Mm.
it won't be this it won't be looking downward and saying, what can we do? It'll be looking outward and saying, how do we actually create coalitions so that we can develop these
Mhm.
courses? And
Yeah.
with whom do we need to partner with to achieve that? Because
Wow.
in a perfect world where I don't live, we would have this great 42 or 48 potential course offerings, and that we would
Yes.
have a whole community with their fingerprints all over that.
Yes, yes. Wow. That's amazing. And that sounds like such a great collaboration. And then you get to tap into oh my goodness, the greatest minds, right? All coming
Yes.
together, yes, to create the best programs. Wow. That sounds amazing, Sue. I love that. And so, from a national perspective, what are the most pressing health human resources challenges, and where do you see the greatest opportunity for long term sustainability?
Yeah, I mean that's a whole PhD dissertation in itself. So
It really is.
I
It
think
really
there's
is.
I think there's a couple of things. One is I think that workers are very tired. I think that particularly in long-term care and community-based care,
Yeah.
where those are slightly more marginalized parts of our sector, is that we have, if you're a personal support worker and you're working in a long-term care home, you're often working your job, you're probably working a second job in order to make ends meet.
Yeah.
So we have a very tired workforce. I think we have an aging workforce as well. And
Yeah.
I think that, those two things have lent themselves to what hospitals in particular are challenged with are overtime, sick time, use of agency time, which adds to
Yeah.
the cost.
Yeah.
What my observation is, many organizations are moving towards not just an HR strategy, but a strategic human resources plan that really says strategically, how do we use our resources to achieve our goals?
Yeah.
And that contained in that kind of strategy sits succession planning, learning and development planning, all of
Yeah.
those things that are reflective of a really dynamic work environment.
Yeah.
And it's just more than like how we're using our people. It's like how do we coach, mentor our people
Yeah.
to success and enable our people to bring their best selves.
Yeah.
And then, alongside that, that's where the college can play a great role because we're in the learning and training and development business. Is that, again, we know organizations are reacting to their environments. We know their staff are tired. We know that they have a limited amount of time. And that's why I think moving to this new model of learning and development will suit
Yeah.
um, our, our member organizations and our members because again, their time and money is reduced, but the appetite for training and development and leadership development is not. So I think our model will really suit meeting those needs in a way that still allows organizations to be very adroit in the way they move forward.
That makes perfect sense, Sue. It really does. And I feel like there are definitely gaps in our sector where we need to be able to access additional training, right? There
Mm-hmm.
really are some gaps, I think, that we need to address. And so I'm glad that you and in the association is looking at that, or the college, I should say, is looking at that. This podcast is brought to you by Maxwell Management Group. For nearly 2 decades, we've worked side by side with individuals, teams, and organizations to uncover what makes them exceptional and to help them grow from the inside out. It's not just about reaching goals, it's about creating success that feels deeply authentic and genuinely meaningful. Organizations like people have stories, and when those stories are rooted in purpose, they become powerful forces for attraction, culture, and identity. We are committed to partnering with brands that want to lead with intention, cultivate vibrant workplace cultures, and become the kind of employer that top talent seeks out, not because of perks, but because of purpose. Over the past 18 years, I've had the privilege of leading Maxwell Management Group's growth into a highly specialized national executive search and education firm, one that thrives on values, vision, and the belief that when people lead with purpose, extraordinary things happen. To find out more about our executive search, recruitment, and education services, please visit us at maxwellmanagementgroup.com. And so let's move on, Sue, to what no one is saying. My favorite part. So there's
Yeah.
been a gap between what's discussed publicly and what leaders are experiencing privately. What's an uncomfortable truth about healthcare leadership, Sue, that isn't being openly talked about?
Yeah, actually, one of our speakers at our national conference was is going to be discussing that, and that is workplace violence. If we think about not violence like physical violence, and of course we know that our healthcare practitioners experience that from patients and residents, and but like how do we treat each other? How do we create culture? And so we know that the pervasiveness of bullying, of gaslighting, of marginalizing populations, of othering, racism, not embracing truth and reconciliation, and our commitments to implementing the recommendations for change. I think those are very uncomfortable conversations. And there are some fantastic leaders out there who are talking about it. But I will share with you, I did some work in Western Canada maybe 4 years ago and I used to specialize in how do you design spaces? How do we create personas, and how do we, create strategic inspired futures? You need to understand the people for whom that future is being designed. And I interviewed many First Nations communities, and there's pervasive racism, and some of the stereotypes that you hear. Someone was turned away from the emergency department because they were deemed to be drunk versus having, a diabetic emergency. And even in some organizations that say, well, you ask them, like, do you have an EDI policy? And they're like, no, we just treat people the same. We don't really need to pay attention. So if they're Indigenous, it doesn't matter. If a person of color, it doesn't matter. And it does matter. And some of that thinking, I think, is a barrier to action. So again, one of our speakers will be talking about just that, and from perspective of nursing, that there's violence within the nursing profession, and it's nurses towards other nurses. And I think those are very uncomfortable conversations.
Yes, absolutely. But really, they need to be had, right? These are the conversations that are so important that we must have if we're going to make change, right? Yeah.
And I think people don't know where to start. I think that's part of the challenge. That again, if you're working in a hospital, and I've worked in a hospital, so I understand it's a busy place. It's a 5 sense experience. So I would say that it doesn't necessarily afford the opportunity to pause and say, like, what could we be doing about these things? So I do appreciate that. But I will share that when in my first year of my PhD, I took a full year course in intersectionality. And I really, I'm a middle-aged white woman. What did I know about intersectionality? It turns out not much. I learned a little bit more by the end of that year. But in that course, we did an exercise called collective liberation. And it was a way of creating safe spaces so that people could educate themselves on others. And the students had to choose an activity. My group chose playing Uno. And what we did was we played a game of Uno, which is like, that seems straightforward. It's super straightforward. But what you were also required to do is talk to your neighbors and move seats and engage in those challenging conversations. And I was totally blessed to be with a group of LGBTQ2S plus students who shared their perspectives. And one of them was, or is a she, they. And I said to them, I understand she, her, I understand they, them. I do not understand she, they. Can you help me? Yeah. And that gave me the opportunity to ask those questions. Otherwise, in my world, I would never have access to that. I would still be, lots of question marks. Yeah. And I'm really grateful to my classmates. I learned a lot about transgender issues and rights and perspectives of those types of students. We had Indigenous students in the class. I learned a lot about intergenerational trauma. And I also learned a lot about about ableism and disableism, and how we are really like an ableist society, and leaning into those things. And so I was fortunate that I had that opportunity and the platform to ask those difficult conversations. I'm not sure everyone is afforded those types of opportunity. And it's not saying that they don't want to. I'm not suggesting that people are crossing their arms and saying no. I
Right.
think it is challenging because you do need leaders to step up and say, we're going to be engaging in those conversations.
That is so true. That's a really important point, is that sometimes we're just not able to, or we don't have that opportunity. I guess we don't have that opportunity to really have those conversations and just be curious. As you mentioned, you
Yes.
weren't quite sure what they meant, right? And you were able to ask that question and just be curious and understand. And that helps us to learn, right? So,
Mhm.
yeah, we need more of that. That's really good to hear, Sue. And so, are there conversations that you feel we should be having at a national level that we're currently avoiding?
Yeah, I mean, there is one thing that's very near and dear to me is that, and I don't think that we're avoiding it. I think that we talk about patient and family centered care quite a bit. We
Yeah.
don't talk about what relational care looks like. And if you
Mm,
think about the way organizations are funded and managed, um, in long term care, for example, um, it's fairly rigid in terms of like how we fund and how we evaluate, and it's all very very task based,
yeah.
and that's evolved over time, and that's
Yeah.
certainly the way it's managed. I think about there's relational care. I think there's been some fantastic evolution in patient family centered care and how we engage patients and families and residents and families. I think that we could take that a step further, kind of apropos what I was saying, is that how do we have relational care towards each other? And
Yeah.
how do we make that part of our organizational mandate? Because we know that the more empathetic we are to our residents and patients and users of care improves their outcomes. But we also know that the more empathetic we are to each other, that
Yeah.
creates better work environments and people are more satisfied. There's lower rates of turnover. There's actually lower errors, lower rates of sick time, lower
Yeah.
rates of all of the things that really prevent us from bringing our best selves.
Yes. And I think that's why it's important. And I've seen a couple of organizations implement best friend at work, right? And
Mm-hmm.
it's actually an initiative that they implement, having a best, they encourage, people to have a best friend at work, and someone might be, mentoring them in the organization, or it might just be peer to peer, but having sort of a best friend at work. And that is so important, that we have people that we can lean on, that we can trust, that perhaps we can just confide in when we need to talk about something that, is bothering us, or that has happened at work that we might not necessarily agree with. Right. So I think that all of those things are so important, and help with retention as well.
Yes, yeah, and there's a lot of great work going on across the country, and I
Yes.
could give you a short list of names, but it would be so limiting.
Yeah.
There's so many great leaders across this country that are really aware of how do we create sustainable, empowering environments for our workers.
Yes.
There's a lot of great work being
Yeah.
done. And
Uh,
I think there's a lot of great work that we can learn from each other as well. But I
yeah.
think that um, again, that it may be because it's close in my mind. I think that having those crucial conversations about what isn't working in the workplace and about that workplace violence, and
Yeah.
then how do we educate ourselves on all of the kaleidoscope of individuals that come into our workplaces, and then
Yeah.
how do we sustain those great communities of care so that it elevates the great times, but also gets us through some of those challenging times.
Yeah, that is so, so important. And not just the physical violence, as you pointed out, but psychologically, like having a psychologically safe workplace as well, I feel is so important, where people feel empowered to speak up and not afraid to say maybe they made a mistake, or they need more information, or they don't understand something, but feeling safe to be able to do that. I think that also goes hand in hand, and is sort of part of that overarching, workplace health and safety that we have to look at, right?
Yeah. And if you think of the challenges too, if you think about some of our leaders, um, that they're supervising, you think about, you go to some of the health authorities, they're like 12 and 13 sites, or you look at some of our hospitals here in Ontario, they have like 10 to 15,000 people.
Yeah.
Getting into these great, sustainable, culturally, psychologically safe workplaces is really challenging
Yeah.
because, again, organizations have a finite amount of bandwidth to begin with. You got to keep the lights
Yeah.
on, and dedicating time and resources to those things is not straightforward. And yet, we've got some great leaders across the country that are doing so many great things
Yeah.
by. It's like expression, a candle loses nothing by igniting another candle, like having
Yeah.
these like cascading leadership structures that are so enabling so
Yeah.
that, someone who's a CEO of a 10,000 employee organization isn't running it all him or her or themselves. Like they're cascading those sentiments throughout the organization.
Yes, yes, so true, Sue. And so that actually is a good segue to good news and future state that I want to move into. So, what, in your opinion, does a successful future look like if we get today's leadership and workforce challenges right? What bold decisions or shifts do you think leaders or systems need to be willing to make?
Yeah, and I think there's probably three things. I think number one is really being deliberate about how do we manage the different generations in the workplace. I think
Yeah,
it's really challenging to find that line of best fit that says, okay, I'm going to meet Gen Z as well as the baby boomers, because there are still some.
yeah,
And I think that's really challenging. And I don't know, I don't off the top of my head, obviously, I don't know how to crack that, but I think that that's really critically important.
yeah,
I think the second thing is where to make investments in AI, that in interoperable AI. And again, there's colleagues across the country that are doing this well. Is that how do you make those investments in a way that allows your workers better capacity?
yes,
I think that's really critical. And then I think the third layer down from that is that how do we monitor? How do we continually monitor and measure performance so that we're always in this area of CQI? And again, many leaders do that. And then finally, on the last piece is with whom do we partner? And I think that purposeful partnerships. We've been talking about this for years, and people will listening may say, we do partner well, and I think it's moving to that next level of partnership where, like in any good marriage, you have to give up something, and giving up some of your autonomy or independence in order to do that. I think some novel partnerships there's lots of great examples of partnerships with the private sector.
yeah.
And with whom do you partner? Because again, the goal is to build capacity, and no one organization can do that all on their own.
That's right. Yeah, that is so true. And you're right. Those partnerships with the private sector, I believe, are key. Absolutely.
Mhm.
And so the healthcare sector took a beating, as we know. During the COVID period, we had a lot of negative press. And do you think that that was a fair representation of the sector? And what are some good news stories that you would like to share that you are currently seeing across the sector?
Well, is it a fair representation? I think you have to sort of break that off into two things. I think that people who work in healthcare are dedicated individuals. So no one goes into healthcare saying, I'm going to do this because I'm going to make a ton of money and, that's going to afford me this elevated lifestyle. I think a lot of people go in because they really truly want to care for individuals. They love the science of it. They love the idea of working within a community. So I don't, you think about the failings. I don't think it's a failing of effort or orientation towards a common goal.
Yeah,
I think that some of the systems, and this has been well documented, I think that some of the systems that we have in place are not necessarily enabling. So if you look at, a lot of press happened for the long-term care sector, as many listeners know. The long-term care sector isn't included in the Canada Health Act, even though there is responsibility for the provinces to provide sort of the legislative base for that. And what that's resulted in is variations on a theme. So
Yeah.
it's not as tightly regulated as, let's say, the hospital sector, or is funded as the hospital sector, because they have the Canada Health Act and the transfer payments behind that. So I'm not convinced that the system is set up in order to optimize. And again, there's been a lot of dialogue around how the system wasn't set up to be successful. I think this is just my personal opinion and not necessarily the opinion of the college, but I think
Mhm.
that when systems fail, I'm not sure we're not relying on the systems, we're not relying on processes. Sometimes we rely on people to do the right thing.
Yeah.
And
Yeah.
I think in long term care in particular, we rely on personal support workers to meet the relational and the care needs of residents. And I think that that's the failing, that we have very conscientious people working in a really high demand environment.
Yeah.
And it's not always supported by maybe some of the systems that we could see. But I would say this impresses me all the time. It's just the dedication of people.
Yes.
And, I'm fortunate. I know a lot of leaders from coast to coast. But what really impresses me, I did when I was in consulting. I was often in a hospital, and I was in one particular hospital. It's an urban hospital, and um, the dedication of the housekeeping staff in a
Mm.
particular unit. And I was doing some interviews and saying, like, I love the idea that I'm actually caring for these people.
Yeah.
And so think of, like, if you're a housekeeper in a hospital, that is a challenging job. You don't know, like, what's coming at you any particular
Yeah.
day. You're
Yeah.
dealing with a lot of, other agents and, biohazards.
Yeah.
And what really inspires me is that despite all the moving parts, that these individuals are, in this particular organization, are lauded as being really critically important.
Hmm.
And, we rely on those people to do so much. So those are some good news stories where organizations are really elevating all healthcare professions and are really saying, like, we need to really cherish our housekeepers and people that work in linen and laundry and all of the people that really make it work. And so those are the stories that you've got leaders that are really dedicated to making sure that everybody is seen, like all those professions are seen.
Yes, yes. There are actually so many good things happening across the nation, like nursing homes without walls as well, right?
Mhm.
We know that there is a huge wait list for long-term care. We know this. We don't have enough long-term care beds right now. There's a lot of redevelopment going on, but as we know, that takes time to redevelop the sites. And so I think that what it's forcing us to do, though, is become more creative
Mhm.
in the way that we
Mhm.
deliver care, right? At the end of the day. And so now we have these nursing homes without walls where people can access the services of long term care from their homes as well, right? And
Mhm.
from the community.
Mhm.
So there's so many wonderful stories, I think, out there, and so many good news stories and good things that are going on that the general public might not be aware of. And so these are all great things that are happening in our sector, and a lot of innovation, I think, is happening right now. To your point, AI tools, like now there's predictive analytics, and there are tools that can predict when a resident or patient might be going to have a fall, or there's lots of things happening in wound care as well to help monitor wounds and better be able to heal the wounds and all of those things as well. So there are a lot, technology is helping. It's a helpful tool, and it's progressing quite quickly in a lot of areas. So all of those things are very exciting, I think, for our sector as well.
Oh, yeah, yeah. And innovation and co-creation and the spirit of partnerships is alive and well.
Yes.
There are, tens of thousands of stories of how people who work in healthcare are not paralyzed by some of the bad news stories, but like,
Yeah.
there's a challenging population or the funding is that they just forge ahead.
Yeah.
And again, they forge ahead. And if you think about it, if you are a personal support worker going into other people's homes, into uncertain environments, they're forging ahead. If you think about rural hospitals, they fantastic partners because they have to be. In
Yeah.
order to build capacity for, broad geographic communities, they have to be. So there's a lot to be inspired by in healthcare.
I agree. I agree. Well, thank you, Sue. This has been such a thoughtful and insightful conversation, and we're just getting started. In
Yeah.
part two, we will go deeper into the realities that aren't always talked about openly. What's keeping healthcare leaders up at night? The uncomfortable truths facing our system, and what the future could look like if we don't make meaningful change. You won't want to miss the second part of our podcast with Sue Owen. So, Sue, thank you for joining us for part one, and we will see you shortly in part two. So thank you for joining us today. Please feel free to visit our website at maxwellmanagementgroup.com. And also, please like and subscribe to our podcast wherever you download podcasts. Thank you for joining, and see you next time.